So, where does a real breakthrough in patient care actually begin? You might think it's in some fancy high-tech lab, right? But honestly, more often than not, every single major leap forward, it starts with a simple, powerful question. A question that comes from a real-world problem. And that's exactly what we're going to dig into today.
All right, think of this explainer as your ultimate high-yield review guide. We're tackling one of the most fundamental steps in all of nursing science. How do you even find a problem that you can research? We're going to break down exactly where these super important questions actually come from.
Okay, so here's the plan for our little researcher's journey. First, we'll check out 5 key paths to finding a research problem. Then, we'll get into how to balance all the evidence, pull out our theory toolkit, and wrap up with something that's non-negotiable: our duty to protect patients. Let's get started.
So, where are these game-changing questions hiding? Well, I want you to think of these 5 sources as distinct paths, and each one can lead to a discovery that could totally improve patient outcomes and push the whole field of nursing forward.
You know, the landscape for finding research problems is, well, it's huge. Ideas can pop up from anywhere: a gut feeling, a conversation, even from funding agencies. But for this review, we're going to zero in on 5 key territories, the most critical and reliable sources you'll find in nursing. So here they are, our 5 main paths. You've got your own personal and clinical experience. Then there's the critical appraisal of literature, nursing theories, big picture social issues, and finally, quality improvement data. Let's take a walk down each of these paths and see where they lead.
First up, and this one's probably the biggest source of all, your own personal and clinical experience. Seriously, think about it. Questions pop up every single day when you're at the bedside. You see a protocol that just isn't working like it should, or maybe a patient has a totally unexpected outcome. That little moment where you just stop and think, why did that happen? That right there, that's the seed of amazing research.
And that hands-on work? It is absolutely invaluable. It gives you a real-world perspective that, let's be honest, you just can't get from a textbook. It's not just about following the steps in a procedure. It's about really seeing what's happening and not being afraid to question it. The big takeaway here? Trust your clinical judgment. It matters. But, and this is a big but, here's the catch. Your experience is powerful, for sure, but it's also subjective, right? It's your experience. So we have to be careful. We have to move from that gut feeling, that intuition, to a proper systematic investigation, and that's where the next source comes in. It's about digging into the existing literature, building on what science already knows, not just running with a hunch.
Okay, let's talk about path number 2, the critical appraisal of literature. I want you to think of yourself as a detective here. You're systematically going through everything that's already been published, and you're looking for the holes in the story. You're looking for the gaps in knowledge, results that don't match up, or questions that other studies just left hanging. And here's a pro tip. Almost every single research paper ends with a section on suggestions for future studies. That's basically a treasure map someone else drew for you. It's pointing you exactly where to look next.
All right, our third source is nursing theories. Now, I know what you might be thinking. Theories are just for textbooks, right? Wrong. Frameworks like, say, Orem's self-care deficit theory, they're not just academic exercises. They're like another kind of treasure map. They lay out these proposed relationships between different concepts, which basically hands you a ready-made hypothesis. You can then take that idea and test it in a real clinic to see if it actually works.
Okay, now let's zoom way out for our next source and look at social issues. Because, let's face it, nursing research doesn't happen in a bubble. It has to respond to the world we live in. Those big health challenges you hear about on the news, global, national, or even right in your own community, those are basically urgent calls to action for nurse researchers. This is our chance to really promote health equity and make a real difference. And here's a really powerful example of what I'm talking about. Back in the 1990s, some researchers in West Bengal were trying to figure out why maternal and infant mortality rates were so tragically high. And what they found was fascinating. It wasn't just about not having enough clinics. The real issues were deep-seated cultural traditions and a huge distrust of the local health services. It was a massive light bulb moment. To solve this problem, you had to understand and address the culture, not just throw more medicine at it. And that brings us to our 5th and final path: quality and performance improvement data.
You guys, your own hospital or clinic is an absolute goldmine of research problems. All that internal data they're collecting, things like hospital-acquired infection rates or patient satisfaction scores, that stuff is basically a big flashing sign pointing directly at the problems. It's a signal telling you, hey, look over here, investigate this. And the best part is, this is where you can make a really immediate impact.
Okay, so you've gone down one of these paths, and you've found a great researchable problem. Now what? The next huge step is knowing how to make a solid clinical decision using all the info you have. And that brings us to a really essential tool for the modern nurse, the decision framework.
Here it is, the evidence weighting framework, and this is perfect for locking into your brain for an exam. See, a really good clinical decision is all about balance. It's not just one thing. High-quality research, that's the biggest chunk, about 40 to 50%. But look, your own clinical expertise is still a huge piece of the puzzle, 25 to 35%. Then you've got the patient's own preferences, which count for 15 to 25%. And finally, you can't forget those contextual factors, which make up that last 5 to 15%. It all has to work together. Okay, next up, the theory toolkit. To do really good research, you need a solid theory behind you. But how do you know if a theory is any good? Well, this next part is your toolkit for figuring that out. Okay, for your exams, I want you to remember one thing. Step G. It's a super handy mnemonic. A solid theory has to be S, systematic, its ideas have to be logically organized, T, testable, you have to be able to actually research it, E, it needs empirical adequacy, meaning there's real-world evidence to back it up, P, parsimony, which is just a fancy way of saying it should be as simple as possible, and G, generalizability, meaning it works in different places with different people. Step G. Got it? All right, let's shift gears now to something that is, without a doubt, the foundation for everything we've talked about. The moment you start doing research, you take on this incredible responsibility. You have an absolute, unwavering duty to protect the people participating in your study. And let's be crystal clear about this. This isn't just a rule you have to follow. It's a non-negotiable responsibility. It is the ethical bedrock of all research, period. So how do we live up to that responsibility? Here are the core strategies you have to use. First, you de-identify the data. Use study ID numbers, not names. Second, you secure all that data, whether that's with encryption or just a good old-fashioned locked file cabinet. Third, you restrict access. Only people who absolutely need to see the data get to see it. And finally, you have to follow the law, strictly adhering to regulations like HIPAA or whatever the equivalent data privacy laws are where you live.
So there you have it. We've given you the map, those 5 sources to find your research question. We've given you the framework to help you weigh the evidence, and we've given you the tools to evaluate theories and to protect your participants. The journey from here, well, that's all yours.
And that brings us right back to where we started. Every single improvement in patient care that has ever happened started with one person, just like you, asking one question. So I'm going to leave you with this thought. What question are you going to ask to shape the future of nursing?